Welcome to the NMTA Northwest Marine Trade Association Medicare Advantage Retiree Plan presentation. This program is available for individuals who are at least 65 and are retired from an NMTA member company. Individuals who are at least 65 years old who are not benefit eligible working for an NMTA member company may also be eligible for this program. In this presentation, we will explore the Med Advantage plans available through the NMTA Retiree Program. We will review the benefits of the group Medicare Advantage plans available and wrap up with how to enroll. Regents Group Medicare Advantage plans. Like the Medicare Advantage plans presented in the Medicare 101, these plans replace original Medicare as the primary payer of Medicare Parts A and B. These Med Advantage plans include Part D drug coverage, extra benefits such as dental, vision, and hearing aid coverage. They include an extensive nationwide PPO provider network. Premiums are lower than Medigap plans. You have one ID card for all covered services. And the Regents Group Medicare Advantage plans have a unique advantage when compared to other Med Advantage programs. The plans can be purchased even if you live in another state in the U.S. They are portable. If you move counties or to another state, you can retain these plans. They have continuous open enrollment, allowing one to enroll any time of the year. If you decide to make a change in the future, you have guarantee issue into a Medigap or supplement plan in that future. With a group Med Advantage plan, you are still required to enroll in Medicare Part A and B, and you must continue to pay your Part B premium. NMTA 2023 Regents Group Medicare Retiree Plans. There are two plans available to choose from. First, the Regents Med Advantage Plus RX Primary PPO, and this has a zero plan premium per month. Second, the Regents Med Advantage Plus RX Classic with comprehensive dental PPO, and this has a $61 per month plan premium. Who is eligible for these special plans? A Medicare eligible retiree who at any time has worked for an NMTA Northwest Marine Trade Association member company. A Medicare aged employee working for an NMTA member company who does not work enough hours to be eligible for their group benefits. Eligible dependents, which includes a retiree's Medicare eligible spouse and Medicare eligible unmarried children. Members can live anywhere in the U.S., not in U.S. territories. Members must be enrolled in Medicare Parts A and B and continue to pay their Part B premium. These plans offer nationwide coverage. Members can travel and live anywhere nationwide. Members can use a contracted PPO network provider in any of the blue highlighted states and receive in-network benefits for non-urgent services. Available in 48 states, Puerto Rico, Washington, D.C., and the U.S. Virgin Islands. Outside of the blue Medicare Advantage PPO network service area, retirees get in-network benefits with providers who accept Medicare. Remember, no referrals are required. Which plan might be best for you? In the following slides, we'll take a look at the Med Advantage Plus RX Primary with a zero premium and compare it to the Med Advantage Plus RX Classic, which has a $61 per month premium. A couple of housekeeping items moving forward. I will reference the two plans as primary and classic. Our focus will only be on the in-network benefits and review of these plans. Both plans have a zero deductible. The annual out-of-pocket maximum is $5,900 for the primary and $5,500 for the classic. Continuing line by line, both plans cover physician primary care visits at a $0 copay. Specialist visits, such as cardiologists, dermatologists, orthopedics, etc., are a $40 copayment under the primary plan and a $35 copayment for the classic plan. Behavioral health visits are a $30 copayment with the primary plan and a $25 copayment for the classic plan. Both plans offer telehealth services at a $0 copay. What benefits are important to you? Continuing on, outpatient surgery in an ambulatory surgical center is a $300 copayment with the primary plan and a $225 copayment for the classic plan. Outpatient surgery in a hospital is a $350 copayment under the primary plan and a $300 copayment for the classic plan. Inpatient hospital is a $400 copayment per day, days 1 through 4, with the primary plan, and a $350 copayment per day, days 1 through 4, for the classic plan. Urgent care is a $45 copayment with the primary plan and a $40 copayment for the classic plan. Emergency is a $90 copayment with the primary plan and a $90 copayment for the classic plan. Both plans cover ambulance for a $275 copayment. Is alternative care important to you? Acupuncture and chiropractic care is a $20 copayment with both plans. The classic plan covers up to 24 visits per year, a little more than the primary plan. Naturopathic care is a $0 copayment with both plans. Massage therapy is a $20 copayment with both plans. Over-the-counter supply allowance. There is none with the primary plan, and then a $20 per quarter with the classic plan. Hearing exams using True Hearing are covered the same in both plans with a $0 copayment. Hearing aids using True Hearing are covered the same in both plans, with costs ranging from $699 to $999 per hearing aid. Vision exams using the VSP network are covered the same in both plans with a $0 copayment. Vision hardware using the VSP network are covered the same in both plans. Frames or contacts have a $100 allowance per year, and lenses have a $0 copayment. Benefits are once per year. Let's look at dental. Preventive dental is covered the same in both plans with 2 visits per year and are covered at a $0 copay. Comprehensive dental, which includes things like fillings, endo-perio, or crowns, bridges, implants, are not covered under the primary plan and are covered at 50% with a $1,000 maximum benefit under the classic plan. There would be no waiting period for the comprehensive dental services under the classic plan. Part D, prescription drug coverage. Fill prescriptions your way. Preferred pharmacies include Walmart, Rite Aid, Albertsons, Costco, Walgreens, Kroger, Safeway, Amazon PillPack, and many more. Mail order pharmacies include Alliance RX Walgreens Pharmacy, Express Scripts Home Delivery, and postal prescription service. There are additional pharmacies available. Visit regents.com/MRG. By the way, this is worth noting should you be outside the area and need prescriptions filled. Formulary. There's an approved formulary drug list, and it can be found at regents.com/MRG. If you ever need assistance, Regents Medicare Customer Service is available at 888-319-8904 with the hours of 8 a.m. to 8 p.m. Monday through Friday. They operate on expanded hours certain times of the year. Use insulin? Pay $35 or less per month for covered insulins at any retail or mail order pharmacy with no deductible. Get more for your money. Get up to a 100-day supply of your long-term medications at the same copay as a 90-day supply. Supplemental drug coverage. Tier 1 folic acid, vitamin B12, vitamin D, and erectile dysfunction drugs at no cost when prescribed by your doctor. Let's look at the drug benefits associated to each plan. This table shows how medications would be covered in the initial coverage stage. After the deductible, the amount the beneficiary pays until you and the plan reach $4,660 for covered drugs. In comparing the annual prescription deductible, the primary and classic plans have $0 deductibles for medications that are listed as Tier 1 and 2. The primary plan has a $200 deductible for medications listed in the Tiers 3, 4, or 5, and the classic plan has a $150 deductible for medications listed as Tier 3, 4, or 5. Medications in Tier 1 and 2 for mail order, 3-month supplies are covered at a $0 copay. The medications that fall in Tier 2 generics or Tier 3 brand and Tier 4 non-preferred, the copays will be the same between the primary and classic plans at $13, $40, and $100 respectively. Tier 5 specialty medications. A beneficiary would pay 29% under the primary plan and 30% under the classic plan. Let's look at the stages of Medicare Part D drug coverage. Stage 1, deductible. Member pays full costs until the deductible has been met. Stage 2, the initial coverage stage. Member pays a copay or coinsurance for each prescription. The initial coverage continues until total drug costs paid by the member and plan reaches $4,660. Stage 3, the coverage gap. The member pays no more than 25% of the cost for brand and generic drugs covered by the Part D plan. Please note, the full cost of the drugs will be used to move you closer to the catastrophic stage. Once a member has spent $7,400 in out-of-pocket costs, they move to Stage 4. Stage 4, catastrophic. The member pays the greater of 5% or $4.15 for generic drugs, and the member will pay the greater of 5% or $10.35 for brand name drugs. Additional benefits. The Silver and Fit Fitness Program. Free access to a national network of fitness centers and gyms. Home fitness kits. Free Fitbit or Garmin activity tracker. Digital fitness programs, thousands of digital workout videos. Getting started, receive a personal exercise plan. And also coaching programs, weekly one-on-one live telephonic coaching sessions. In-home support, Papa Pals. This program is designed to combat loneliness and social isolation by connecting members for companionship and help with activities of daily living, including but not limited to non-medical home support provided at no cost up to 48 hours a year, help with light chores, meal prep or rides to a doctor, and more. Phone conversations, grocery delivery, and other no-contact support. There are more extra benefits and programs. Personal emergency response system, free medical alert device for 24/7 assistance at a push of a button, with monthly monitoring charges covered at 100%. Meal delivery services, free nutritional support for managing chronic conditions or after an inpatient hospital stay. This may include meals delivered directly to your door anywhere in the country at no cost. Are you ready to enroll? Do you have questions? Please feel free to email or call me, Mike Jackline. My phone number is 425-526-3469. Or you may contact Regents directly at 888-319-8904. Thank you for your time today.